In the fight against one of the world's deadliest diseases, experts are uniting to change the narrative. Healthcare professionals from across the globe gathered in Enugu for a Breast Cancer Symposium organized by the Focus Diagnostics Nigeria to drive conversations around early detection and preventive care. Themed Early Diagnosis, First Step to Wellness, the event held at the company's Independence Layout Center over the weekend and focused on how timely screening can save lives and reduce the burden of breast cancer in women. While speaking to newsmen, the Managing Director of Focus Diagnostics, Dr. Gerlinde Reiprich, said the symposium underscores the company's commitment to advancing preventive healthcare and saving lives through timely diagnosis.
Diagnostics Nigeria is a private medical diagnostic center, and on a regular basis we want to get an exchange, a technical and scientific exchange with the doctors who are referring their patients to us. And then we also want to give back to the community. So creating awareness about breast cancer, we believe that is a very important task, because as you could hear during the symposium, so later presentation of the patients is the major issue that we see. And in the community, cancer is not talked about. People are shying away because they think it is a death sentence. But if patients came earlier, so then something could be done about the disease. You have witnessed the cancer survivor, how she talked about her disease and how she went through it and how she survived it and is cancer-free now for 7 years. This motivates us to organize these exchanges, because then we can, reach out better to the communities, and the word goes out that cancer is not a death sentence and that something can be done about it.
The National Coordinator of the National Cancer Control Program, NCCP, Dr. Uche Chukwunwoku, discussed the challenges of the breast cancer care in Nigeria and the steps being taken by the federal government to improve access to screening and treatment.
Challenges can be classified as challenges with the populace, citizens, and some challenges that can attribute to government. Okay, so the one that has to do with the populace, or the one that cut across everybody, of course, is awareness. There's relatively low awareness. Okay, even though with the Breast Cancer Awareness Month, which is October, there are a lot of activities going across the country, both by government and the civil service organizations. So awareness has been created. But the major component of the awareness that is missing, or that has not been properly addressed, is awareness, what I've described in the hall, with awareness among the health workers themselves. Okay, so there are still a critical mass of health workers, especially those in the private sector, who do not yet understand the importance of not keeping people that are suspected to have cancer. Okay, so if people have come for health checks or for hospitalization for any other reason, they need to be screened for cancers so that they can be properly referred early enough to the tertiary health institutions where they can be properly taken care of. So government is trying to provide facilities for screening, for diagnosis, and for treatment across the country, so that when people are diagnosed early, they can go for treatment. And the government is also supporting some patients to also be able to access treatment.
Also speaking at the event, Dr. Julia Herberger, a visiting hematologist-oncologist from Germany, shared her motivation for visiting Nigeria and participating in the awareness campaign.
I'm a doctor who is specializing of the treatment of breast cancer, and I think it was very important now to see the structures in the hospitals, in the pathology, in the staging, like X-ray, and therefore I think for me the contact to Nigeria was very important to get a close contact between the doctors over a global contact to the doctors. I think there are two main points. In Europe, the screening is absolutely established. You are invited every 2 years for a screening, and it costs nothing for the patient. And the second is that we have a health insurance, and therefore for a patient it's not the problem how many therapy will cost, because the health insurance is paying everything for the treatment of breast cancer.
On our part, Dr. Etima John, Center Manager for Oncolonics Africa, emphasized that early detection remains the key to successful treatment and survival for breast cancer patients.
There is not much information about it. Some women do not know that such things exist, and the environment where we're in, we believe that everything is either caused by one thing else or the other, meanwhile shying away from the main thing. So early detection is very, very important, because the chances of actually getting a reversal is very high if it's caught earlier than when they present at the clinic. But if you come in when it's too late, there is little to nothing we can do. What we can do is just to improve your quality of life till when it is time. So let's just be real with it. So it's very important that women get this done. The awareness is also what is lacking. So people in the cities might have the awareness, but those in the villages, they don't have. So that's why we're reaching out to more women at a time. In August, during the August meeting, just to sensitize them, because it's very important.
With breast cancer remaining one of the most common cancers among women, the Health Focus Breast Cancer Symposium reinforces the call for early diagnosis, awareness, and continuous screening, capturing the true spirit of Pink October.